Hey everybody, this is Dr. Stephen Windley, and today we're going to talk about food allergy testing. I've been using some form of food allergy testing for over 20 years, and I've found some benefits with it. I've also found that it's not a perfect testing scenario, and I just wanted to discuss what I share with my patients in terms of what we talk about with food allergy testing and what I want them to think about before and even after the test. The short and sweet on this. So, food allergy testing, there can be certainly life threatening allergies, and sometimes that's known just because the patient's already ingested it and had a serious reaction. But sometimes there are reactions that cause not so life threatening but chronic issues. A lot of integrative practitioners use food allergy testing to help provide a broader assessment of what's going on, whether it's in the gut or other problems. And there are various types of tests, there are various companies, there's different types of allergens you can test for. The symptoms that you might see with food reactions are many and can cover a lot of things almost head to toe, especially gut issues though, diarrhea, constipation, bloating, those kind of things. Then headaches can be involved, joint pain, muscle aches. I've seen skin rashes be involved, which is pretty common. Brain fog, fatigue, food reactions that your body doesn't tolerate can induce nutrient deficiencies such as iron. So many things. What I want my patients to know are that there are many ways you can react to a food. There's not just one path that this happens through. There are different antibodies that can react to food. These are the parts of the immune system that are involved in the reacting. And the different tests will check different antibodies. So I've had clients say, hey, I went to this office and it showed this, and then later on I went here and I got a very different result. Well, they could have been testing through different mechanisms. So one type of antibody is this IgE, and those are usually the immediate reactions that can occur within seconds to minutes and often can be life-threatening. Not always, but they can be. Usually when the throat is swelling and the airway is getting cut off. And so it's very serious when that happens. This is often what is tested at an allergist office or a hospital lab. It's usually not a daily issue because eventually the problem is found, whatever the food trigger is, either through testing or through experience, and it's very heavily avoided to avoid that serious problem. The others include IgA and IgE. These are not so immediate typically. They can be delayed. So instead of seconds to minutes, this might be minutes to hours. And it can be several hours after the food is ingested. And it can be complicated because if it's a food like wheat, you might eat wheat for breakfast and perhaps lunch and dinner. And so it's hard to really determine the food reaction because it's kind of going on all day. These can be chronic reactions. They usually are not life-threatening, but they can be very frustrating. And they can be very broad in how intense they hit a person. These tests are done by many companies. They usually are not covered by insurance. Sometimes they are, but oftentimes not. And in general, I tell patients these tests are not perfect. Again, you got to compare the antibodies. These tests rely on the immune system. The immune system is always adjusting to the environment, which it needs to do so that it doesn't constantly over or underreact. And then the companies are not perfect. I don't have any vested interest in any one company. I'm not trying to sell you anything today. It's just that's how it is. These they do the best that they can. Other options would include doing an elimination diet where you pull out one food or maybe many food groups for a period of time, 2 weeks, 3 weeks, or longer, and then slowly introduce the foods one at a time to see how your body reacts. You see how you are away from the food, then you see how you are as you bring it back in. And this usually is done with big food groups like gluten, dairy, corn, soy, peanuts, those I listed. Nightshades can be another one. And you pull them out and see how you feel while they're gone. It can often take 2 weeks or longer for your body to reset, so you don't want to do it for just a week. And then you slowly add things back one at a time and see what you notice. This is a lot of work. It's not always easy to do this, but it tends to give very specific answers, and it really educates the patients, I find, on what they are truly sensitive to. These tests are helpful when the patient uses them as a guide, not the law of the land. I don't draw these on every patient. We do use them, and I've had a lot of help with them at times, and at other times it's not told me a whole lot. So I don't draw them for everyone, but sometimes it is important to have. It does help patients become more aware of what they're eating and help with their food quality, their food choices. You want to make sure you're doing the right test. Is it a severe quick onset reaction, or is it more of a delayed reaction? And choose the right test accordingly. And some patients just tell me, Doc, I need to have something on paper to give me a starting block. I just don't know where to start. And if that's the case, it may be the right thing for them to do. And that's the short and sweet on this. They can be helpful. They're not perfect, but if you can use these guidelines, you hopefully can get the most out of them when they're needed. This is Dr. Steve Windley. Thanks a bunch for listening.